Welcome to Living a Full Life podcast. Join us as we explore health topics that encourage raising healthy children, living a healthy life, and living the best life possible. Now, here's your host.
The jazz fingers.
Okay, we are about to begin. Hi everybody, my name is Dr. Sarah Bober and I am pediatric and prenatal chiropractor here at Full Life Chiropractic in Tampa, Florida, and this is
Dr. Crystal Corona. I'm also a pregnancy and prenatal chiropractor here in Florida.
Yes, and we are so excited to be chatting with you guys as we kick off this podcast. We're kind of going to be talking about different topics of different kinds of patients that we see in the office, and we really just wanted to go do a deep dive into prenatal chiropractic and explain more about what we do and how it is helpful. A lot of people ask me how I got into seeing so many babies and kids, so I thought that I would share a little snippet of that story. So growing up, I always had really bad migraines. They started when I was in elementary school, and they happened all the way throughout my life into college, and I was actually planning to go to med school. But when I was in college, my migraines just kept getting worse, and when I went to the medical doctor, they just said, here's some pain medication, hope you feel better. And I didn't feel better, and I didn't want to be on medication at 19 years old. So I went to a chiropractor, and my migraines went away. And that is how that's a short story of how I got into chiropractic care. But when I went to chiropractic school, that's when I learned that you could actually work with pregnancy and babies. And I had always wanted to be an OBGYN or a pediatrician. And so when I found out that I could kind of do that from a chiropractic lens, I was really stoked. So that was my kind of story. And I don't think I've heard Dr. Crystal's story, so I'm excited.
So my story is very similar. It is, I always wanted to be a doctor, and my doctors, luckily for me, were very reserved in prescribing prescriptions. So I was like, that's what I want to do. I want to be more holistic, and I don't even think I fully knew what that meant. So I was like, gonna be holistic, gonna be an MD, gonna apply, gonna be a pediatrician. I thought about OBGYN, but it was like pediatrician or a primary care physician. And as I was applying, someone was like, holistic, you want to be a DO. So I'm like, gonna look into DOs, and that's what I'm gonna be now. And then as I was applying to med school and doing everything, and I just got this feeling I should talk to my neighbor. They've got a white coat. I think they're an orthopedic surgeon. They're going to tell me how great school is. And they were a chiropractic student. And they're like, this is what you want to do. You want to be even more holistic, and you want to be a chiropractor. And I was like, sign me up. Actually, no. I said, no, don't sign me up. I don't know anything about chiropractors. They might be a little cuckoo. But I begrudgingly went and looked at a chiropractic school, and my husband loved his chiropractor. He was being treated for costochondritis, and his DO actually recommended chiropractic compared to medication. And after I applied, or after I saw the school, I applied, having never been to a chiropractor, and so my husband said, we have to fix that too. And so then I applied and became a chiropractic student, and I also learned about pregnancy and babies, and I was like, this is perfect because this is what I want to do. I want to be a pediatrician, but I also want to help the whole family. I want to be a family chiropractor and work with pediatrics and work with pregnancy, because I feel like that is a limited area that we really just kind of say, well, there's nothing you can do during pregnancy, just wait your 9 months and you're done.
Mm-hmm. Yeah. Did you get adjusted before you went to chiropractic school?
I did.
Okay, because there were people in my chiropractic school who had never been adjusted until they were a student. And when you're a chiropractic student, you actually you become a patient of other students. And so if your first adjustment is from a chiropractic student, it is like a rocky road into the profession. So bless those people. But anyways, today's episode is not going to be all about just plain chiropractic and why we're so passionate. Be on the lookout for an episode like that. Today we're just going to talk about prenatal chiropractic. So just like Dr. Crystal said, getting adjusted during pregnancy can be so helpful, but a lot of these moms, they don't know. They have low back pain, sciatic pain, tailbone pain, round ligament pain, pubic bone pain. Maybe they were used to being really active and they wanted to walk 2 miles a day, and now whenever they walk more than 3/4 of a mile, they start feeling this like groin pain and tension in their back. A lot of women, as they get pregnant, their breasts get larger, And so modern people, we have horrible posture anyways, as we both sit up tall. But as your breasts get bigger, that tends to pull you into this more concave position, and that puts a lot of stress on the upper back and between the shoulders. If you already have any existing conditions like headaches, low back pain, any like digestive issues, sleeping issues, reflux, those can all get exacerbated during pregnancy. And chiropractic is a really holistic solution that is helpful.
Yeah, and I think even like we just think number one, low back pain. They're like, I just have low back pain. But if you think about your gravity changes, so you're like pulled towards the ground. And that just, I had low back pain before pregnancy, and then chiropractic, I was like, oh, I should be using muscles I never used before.
Mm-hmm.
Yay! Like now I know how to use them. No more low back pain. And then I got pregnant, and all the pains came back, and I was like, okay, well, I'm lucky because I can have Dr. Sarah, Dr. Rico, whoever, someone adjust me, please. I need it now. And I felt like that's what made the pregnancy, at least for me, so easy. I didn't have most of the complaints that you get with pregnancy.
Yeah. Did you have the low back pain? It was just like a chronic issue that you had, or?
Mm-hmm. Yeah. Chronic issue, no trauma that I can think of.
But you thought you had healed it, and then pregnancy was like, hello.
We're back again. It's back.
You know, we say this when we work with babies a lot, because when you have these like misalignment patterns in your body, whenever you experience like a transition or a growth spurt or a pregnancy, something like that, or with kids, whenever they experience a growth spurt, we often see these patterns resurface. And it's so interesting because pregnancy is a time of growth as well. And like Dr. Crystal said, your center of gravity changes and your body has to adapt and recalibrate and figure out how to move for two people and how to move with an extra 20, 30 pounds or more. And that can be really hard on your body, and you can experience these issues that you thought you had said sayonara to, but they have come back. And so the next thing that we're going to talk about is just like we kind of talked about why people might want to come to chiropractic. The one thing we didn't actually mention is that a lot of people come to chiropractors just because of the things that we're going to share coming up. They know how beneficial it is during pregnancy to have really good alignment. And your baby's nervous system and their spine is also developing while you are pregnant. And so any misalignments or abnormal tension that you have is going to restrict the amount of space that your baby has, and that's going to affect their own like biomechanics, how they move, as well as when you're stressed, you are sharing your hormones and your neurochemicals with your baby, and that's going to lead to a increased stress response with them as well.
Yeah, totally. I believe in that 100% because you get those hormonal changes, and a lot even happens. Life doesn't just stop because you become pregnant and like you're like, I'm pregnant, I'm in this happy world, and then life and reality hit, and you're like, I have to manage my stress so that it doesn't affect baby or affect myself, because we like to wear shoulders as beautiful earrings all the time. and it takes, managing the stress and also that alignment of our spine to help bring us back into that posture and remember that, we can keep going forward without any pain, or even just that release and tension we don't think about with chiropractic adjustments. It can actually release, I'll say, the emotional stress that we hold on to.
Mm-hmm. This is so true. So we'll give you kind of a quick definition of what chiropractic is. And so chiropractic literally means healing by hands. And so through our hands, we're able to realign the spine in order to facilitate better biomechanics and better nervous system function. And a lot of people don't really realize what the connection there is with the nervous system. And the simplest way to explain it is that your spine protects your spinal cord. And your spinal cord is the communication highway for information between your brain and the rest of your body. Between every single joint, the joints kind of stack like this all through your spine. Between every joint, there's spinal nerves that carry information to every cell, tissue, and organ in your body. And when you experience physical, chemical, or emotional stress that you can't regulate, it creates misalignments at those joints, and it directly impacts that nerve channel that signals information between the brain and the body. It acts as kind of a blind spot to your nervous system, and that creates a heightened stress response, which causes more cortisol, causes you to be on like hyper alert, causes more anxiety, affects your sleep, digestion, all of those things. And so for prenatal chiropractic, what we're doing is we're taking that foundation of chiropractic and we're just adding another lens that says how can we accommodate for, or how can we take into consideration these gravitational changes that are happening and center of gravity with pregnancy and change our analysis just a little bit so that we can pay attention to changes that are happening during pregnancy and also what changes are going to happen during labor or what needs to happen, because the tailbone needs to really open up for labor to occur and for babies to make their way out of the uterus. And if those things can't happen properly, then we'll often see people who are stalling in labor, they're having failure to progress. They might have a C-section because these things are not happening properly. And so we can really prevent a lot of that stuff through chiropractic care.
Yeah. And for myself, like what you said, like stalling labor, if you ever watch like Grey's Anatomy and the birthing,
yeah, they're like,
they're like, ah! And like I would cry. I would like, I don't want to do that. Can it just be so easy? Like, can it be easy? And everyone's like, it's okay. You're gonna handle. Your brain's gonna forget, which it does. And like I was telling you, my birth was super easy, and I hope everyone has that, because I'm like, it was fantastic. It was my first time. Let's do it again.
So why do you think that is?
I think I listened to my body during the birthing process, but also like I'll say I got adjusted when I needed to, but during the birthing process I just listened. I was like, I want to do this, and they're like, oh well, maybe, you know, they like, when I say they, I mean my midwife, my doula, they were leading me into where they knew I should be going, but I wasn't ready and I was scared. But I was so scared because I love Grey's Anatomy and I love to watch it. I wanted to be an MD. I didn't want to be a surgeon though. And every time there was a birthing scene, it just freaked me out and I would cry. And then after I had my baby, I watched these scenes again. And I'm like, that's still so scary, but I don't cry because that was not what my birth was like. It was not like that at all. It wasn't scary. It was beautiful. I felt it was safe. It was easy. And literally getting back into my car after having the baby, I was like, yeah, I could birth again. That was fine.
That's so cool. We should do a whole episode where I just interview Dr. Crystal about how she planned for birth and how she changed her mindset, because that's such a huge thing. And if you don't mind me sharing, she gave birth in a birth center. And I think that's such a big reason why she had the birth that she wanted, not necessarily because it was at a birth center, but because it was in a place where she felt safe and supported. She felt like the people around her were really curated to have the outcome in mind that she wanted. And a lot of times in birth, we are really facing a lot of resistance. And C-section counts for over 1/3 of birth outcomes in the United States, and that number is drastically higher in so many different countries. And you really have to go into birth knowing what situation you're going to be in and how those doctors or midwives are trained and what they are comfortable with. And so learning like different questions that you can ask to really be more empowered through the birth process and through pregnancy can be such a big deal. And I think, like Dr. Crystal said, like getting back her autonomy and being like, these people, her midwife and her doula, like they know birth. They see people birth all the time. But they were like, okay, Crystal, like let's try to move like this. This might help things open so baby can come down. And Crystal's like, I don't want baby to come down. I'm not ready for this. I think she could just stay inside. That would be really great. Okay.
Or just magically appear.
Yeah, or
magically appear. But yeah, like what you're saying with the statistics, like my bachelor's was in public health, and one of the classes I love was maternal and child health care, because they talk about the other countries. I'm totally going off topic a little bit.
It's okay.
But they talk about that. They talk about why is it here in the U.S. our mother and infant mortality rates are up, but in third world countries, they're low. There's something to be learned there. Because we always think third world country, they don't have like the best, but we have the best, but we have higher death rates. Why?
Mm-hmm.
So.
But you know what our ranking is? We're in the top 5 or something, right, of worst maternal outcomes.
Yeah.
Even though we spend like the highest per person on healthcare, it's really bad.
Yeah.
And a lot of moms, they also come to us because their babies are in bad positioning or they're breech. And breech is a variation of normal. And it doesn't always mean that there should be a C-section, but because that training has gone out the window in a lot of hospitals, it's really hard to find a provider who's comfortable with that kind of delivery. And so moms are under a lot of stress trying to make sure that their babies are staying head down. And it's really normal for babies to move all around. That's one of the biggest questions that we ask during our initial visit is, one, how are you feeling? What symptoms are you having? Are there any signs of physical aches or pains, any pelvic floor dysfunction, any history of physical trauma? What's your emotional stress right now? Like, we all just got out of this pandemic. And that added a lot of stress onto our body. what's your current like chemical toxicity, and those things kind of help us figure out like what stressors you're up against. I don't know where I was going with that.
just all the things that we go through in pregnancy, like I feel like our exams are a little more in detail compared to I went to an OB, and we could talk about that at another day. But I went to an OB, and I feel like I had to go see all these other people and sit all these other waiting rooms before I didn't even get to the OB. I guess she was a nurse practitioner. But still, even still, like they I think our exams are more in depth compared to that exam. Like history wise, palpation wise, we don't do a vaginal exam, but neither did the nurse practitioner. So a tech did it, and so.
And what does it really tell you, anyways?
That I had to do. We'll talk about another time. But I had to do something that I did not want to do, and
that's a nice little like teaser. We'll have to get into that later. But what I was going to say before I lost my train of thought is we do this whole history process to figure out like what was your toxic burden coming into pregnancy, what's your physical stress level, your emotional stress level, and then like how are you experiencing pregnancy right now? Like what's your sleep like? What's your digestion like? How is baby moving? And so a lot of babies, they're going to be crammed in one side more than the other, and they're going to be really pushing into the ribs or pushing down on the bladder, or they might favor the left side more than the right. And that's not typical. Babies should be exploring the entire uterus throughout the entire pregnancy, and they really shouldn't nestle into like a head down position until like 34, 35 weeks. And so if any time before the late third trimester, baby is just hunkered down in one position, that tells us that there is abnormal tension in the body, because the uterus is like a hot air balloon. And not really, but if we can think about it like a hot air balloon, and it's in the pelvis, and it's anchored into the pelvis with all of these ligaments. And those ligaments, when one side is more tight than the other, under more tension, it's going to create tilting and distortion of the uterus. And even in my head, I've not noticed, I wasn't trying to do this, but if you're like this, that's literally what's happening to the baby. And as the baby comes down, I wasn't going to use myself as a baby, but here we are. So as the baby comes down the pelvis, they're supposed to be nice and straight with their heads tucked. And if they're really extended, that's going to cause a lot of compression on their body, and it's going to create a lot of back labor and really a lot of discomfort for mom. If the baby's head is really tilted to one side, because maybe the pelvic floor muscles are really tight on one side and really stretched out on the other side, that's going to create what we call an asynclitic presentation, which is just asymmetrical. And one, we got to think about that baby's developing spine and nervous system, because all of those contractions are going to be like, meow, meow, meow. But also, like, that's going to be really hard for that baby to navigate through the pelvis, because when you look at the pelvis, it's going to be kind of the opposite of my hand, actually. It's going to be wider side to side and more narrow front to back. And so that's why when the baby comes out, we want their whole body turned to face either the left side or the right side. Typically, it's the left side that's more ideal, but it really depends on your own unique anatomy and what's going to facilitate a more optimal position. And so that's why we never say, we're going to move the baby, we're going to put the baby in a place. One, we don't do that. That's not what chiropractic is for. Two, like, we cannot reach the baby. We're not going to be adjusting the baby. Three, that would be practicing obstetrics. But four, like, we never want to get in the way of the innate intelligence of the body. And so we believe that your body is really smart and it knows exactly what you need. We just need to get all that interference out of the way. And so what we're doing in chiropractic is looking from a structural perspective to see what's in the way. And we do that through some different components that we're going to look for in what we call the Webster technique. And the Webster technique is the certification that all chiropractors should go through if they're going to be working with prenatal women. The Webster technique, if you want to find somebody who does it, you can go to ICPA 4Kids, the letter 4, number 4. ICPA 4kids.org, and there's a find a local chiropractor, and you can see who in your area is Webster certified. So Dr. Crystal will kind of explain the different components of the Webster exam.
Yeah. So here in our office, we have nice pregnancy pillows. They've got a nice little cutout for belly and baby so that they can fit in, so you can go face down. It's one of those few times you actually get to like lay face down and feel like that tension come off the low back, because where else can you lay face down? You have to lay on your side or sit up, try and position yourself. And here we can look at your leg length and look at some resistance within the pelvis, because when we have that resistance there, we want to adjust it, like Dr. Sarah said, to create more space and more room for baby, so baby can move around and flow. Because if baby's just stuck in one spot, you're going to feel it too. You're like, oh, my belly's kind of like stuck in that area. And so we look at first the joint, because we're looking at the spine, we're looking at the pelvis. And then we look at the muscle. So you've got this nice, thin, tiny piriformis muscle that lays right over your sciatic nerve. And when it lays over that, that's where you hear of people complain about sciatica, having pain going down to the leg. And some people experience that during pregnancy. And if you're one of the lucky few, you were born where your sciatic nerve actually pierces through the piriformis. And so now it can get squished on either side. That sciatic nerve can get squished both ways. So we work to release those muscles because, like I said, we want to have that nice balanced pelvis. That includes our glutes. And then we go in for another ligament. So this ligament, you might, if you've experienced it, you're like, what are they doing? Hopefully your chiropractor has explained. There is a sacros tuberous ligament that connects from your tailbone, the coccyx, down to your ischial tuberosity. It's that little sit bone where you're sitting. And that can get tight. And like that hot air balloon, our belly can tilt to one side. And you might notice some people actually have a tilt. Some people don't, but they have the tension to one side. And so we contact that ligament to help relax it and release it. And so that's just one portion. That's just one half of you. We still have to turn you over after you've been adjusted. And so the relaxing of the low back, you go onto your back. And then same thing, we're going to look at the muscle, the ligament, and we're going to look at another bony piece, which is the pubic bone. So pubic bone pain, we'll see if you have any pain, if there's a misalignment within that pubic bone, that pubic symphysis, if it's misaligned, even just slightly. So when we show, like I'm using my hands here, if we show like it looks like this, it's really like a couple millimeters off. You don't realize that 1 or 2 millimeters makes a huge difference to where you feel pain. And then we go ahead and we look at that, see if it needs an adjustment, work on the psoas muscle, because that psoas muscle helps keep you upright. And so we want to work that out. And then also your round ligament. So most people know, our round ligament, it's near our uterus. It's helping us to keep everything balanced. Is our uterus going forward, back? We want to relax the tension on there. And so that is all a component of the Webster technique. But you're still getting a chiropractic adjustment. We're just being more gentle. We don't want to jump on you. Mm-hmm. You don't want anyone jumping on you when you're pregnant. You already have a baby or two or multiples.
Yes,
and
we have taken care of multiple twins.
If you've got kids already who are trying to jump on you, I don't think you want an additional person jumping on you.
Yeah, so there's different ways to do the chiropractic adjustment. You can do it through hands-on adjusting. You can do it through more instrument-based. Some of these jumping on adjustment kind of things are where you're laying on your side and specific pressure is applied to your tailbone. And there's actually really safe, gentle ways to do that during pregnancy. But you just really want to go see somebody who's trained in this. So if you're going to see somebody who is... We're getting a secret message under our...
I think we have got patients soon.
That's okay. We're about done. So we'll have to keep this part in the video, but I knew that was coming.
We were talking about safe adjustments, different adjustments.
So there's lots of different adjusting styles that are really helpful for pregnancy, but it's really important that you see somebody who is certified in the Webster technique. If you're seeing somebody who's not certified, more than likely, one, they're just not going to go as in-depth and check a lot of these key structures that we mentioned. And the other one is it could be potentially harmful if they don't know how to work with the hypermobility of a pregnant woman's spine that can happen during pregnancy. And so a lot of people have ligament laxity in their joints, and that increases during pregnancy for all people. And so that means that you might actually not need to get that manual adjustment, and you might do better with some more stability instead of mobility. And if you're not checking for that, then you're not going to know. So a good way is just to ask the provider what they're checking for and how they know where to adjust and if they are trained. And if they are not Webster certified, that doesn't necessarily mean that they don't know what they're doing, but you do want to ask a question to them to have that conversation.
And I think it's important for all, during pregnancy, for all your providers to ask them questions. If they are just not answering you or get defensive, they know what's
trust
best.
Me, I know what I'm doing.
They know what's best. There's a reason you felt the need to ask a question. Ask it, and if they won't, might be time to find another provider. I say that carefully because everyone loves their provider. I have providers that I love, but maybe they're not the best for pregnancy or for you wouldn't go to a chiropractor for surgery, we don't do surgery, at least not here in Florida. So it's always best to ask those questions. I feel like I like to tell my patients, ask me all the questions. If you don't have the question today, you have it next time, or you think of it when you go home. Email me, call me. Like, I want you to know that I'll answer that question. I'm not going to shut down. Or maybe I need to look up the answer.
And if we don't have the answer, we'll often say, I actually don't know, but let me find out from a friend, or you can contact so-and-so, and that's where you can get that information. And so we really want to be like your sounding board for any questions that you have throughout pregnancy. Our knowledge, our wheelhouse is going to be more in like the holistic, natural, alternative kind of recommendations. And alternative gets a bad rap too, because those are really like the traditional ways that people have been doing things for the dawn of time until the era of modern medicine, which has now become the primary way of doing things, and now we get to be called alternative. But the people who know, so we're not worried about it. So if you want to know the alternative kind of crunchy ways to do things, we're going to be able to help you with that. And our job is not to make those decisions for you. It's really just to provide you with information so that you can make educated and informed health choices. Real quick, we are going to go into just the 3 goals of the chiropractic adjustment for pregnancy. And so those are called power, passage, and passenger. And so as we talked about before, your spine protects your spinal cord, and those nerves travel to every single muscle, joint, ligament in your body and control and coordinate every function. So if you have a spinal misalignment, that's going to affect nerve signal to the muscles of the reproductive system, to the pelvic floor, to the ligaments that are stabilizing and holding the uterus upright, to the hip flexor muscles involved in the movement of the pelvis and the leg. So that is the power part. When you're in labor, a lot of people think you really want a nice strong pelvic floor, but it's actually the opposite. You want a really relaxed pelvic floor that's not holding too much tension or too little tension. And the power actually comes from your uterus. And so a lot of people actually experience this fetal ejection reflex, where the contractions are drawing up those uterine fibers to the top of the uterus, and then there's a ejection reflex. There's much better diagrams online for you to find,
which I didn't really learn about that till after I had baby, and I'm like, I think I experienced that. So
yes,
something to talk about next.
Yeah, and it's not to create shame around. A lot of people need to feel really safe in order for that reflex to occur, and even if you have like the perfect birth, some people still don't experience that reflex. So something to look into. The next one is passage. So what we're doing is we're creating symmetry and balance in the joints and ligaments and muscles that support the uterus and that are literally surrounding the birth canal for the baby to come out. And so Dr. Crystal talked about checking the tailbone. The tailbone literally needs to kick back to open the top of the pelvis for the baby to go down, and then it needs to kick forward to open the bottom of the pelvis for the baby to come out. And if it doesn't have that rocking motion, baby's going to get stuck. A lot of times we call this stuck in transition, where they come down and they can't quite make that spin because there's not enough room in the pelvis. And chiropractic deals directly with this. The last one is the passenger. So we are not adjusting the baby. We kind of already talked about this, but we're dealing with the space that the baby has to live in. And so by creating this symmetry, we affect the room that they have so that they're not crunched in one side of the uterus. They can actually have even symmetrical range of motion that makes sure that they are decreasing their own misalignments that they're going to get throughout pregnancy. And it helps them get an optimal position for birth. So, yeah. I think that about ends it. We might have to do a part 2 because we have to run to our patients.
Or else we'll be here forever talking, which is great. It's really great. We just have to, we'll talk a little bit about, we'll have to listen and talk a little bit about, how is your provider, your experience, having a good support system, that natural reflex. We can talk about me and some of the stuff I've gone through.
Yeah, we'll go through Dr. Crystal, and then if you guys have any questions, feel free to reach out to us. We're both on Instagram. I'm Dr. Sarah Bober, and she's Dr. Crystal Corona, and then our office page, Full Life Chiropractic. So reach out to us, ask questions, because there will be a part 2. The last thing I was going to say is that when you're having a really healthy pregnancy, at minimum, we recommend getting adjusted once a week. But if something else is going on that we're really working on troubleshooting, you're going to expect to come in anywhere between 2 and 3 times a week. So if you have any questions, reach out to us. We are here for you.
Yeah.
Bye.
Bye.
Thanks so much for tuning into this episode of Living a Full Life podcast. If you're enjoying the show, please feel free to rate, subscribe, and leave a review wherever you listen to your podcasts. That helps others find the show, and we greatly appreciate it. Thanks again for tuning in, and we'll catch you in the next episode.